How did they treat bladder stones before modern anesthesia? Imagine a time when medical procedures were performed without any pain relief, and the risks were enormous. That was the reality for treating bladder stones before the development of modern anesthesia. Bladder stones, or vesical calculi, have been a problem for humans for thousands of years, with evidence dating back to ancient Egypt and Mesopotamia. Back then, doctors had limited options, and treatments were often dangerous and extremely painful. Early treatments mostly involved herbal remedies and potions, hoping to dissolve or pass the stones naturally. When these failed, surgery was the only choice. The most common surgical method was called perineal lithotomy, which means removing stones through an incision in the area between the anus and the genitals. This procedure was first described by the Roman doctor Celsus around the 1st century AD and was refined over centuries. Performing this surgery was no small feat. The patient had to be positioned with legs bent and raised to expose the perineum. Since there was no anesthesia, the patient endured intense pain during the operation. Surgeons had to rely on assistants to hold the patient still. The surgeon would insert a finger into the rectum to feel for the stone, then make an incision in front of the anus, extending into the bladder. The stone was then removed with fingers or specialized hooks. Over time, tools like grooved instruments and forceps were introduced to help with larger stones. For men, enlarged prostates made the operation even more complicated and risky. Children had slightly better chances because their anatomy was more favorable. But no matter the age, the risks of severe bleeding, infection, shock, and death were very high. Without anesthesia, patients experienced excruciating pain, and without antibiotics, infections often proved fatal. Some desperate attempts involved passing sharp instruments or nails through the urethra to break up the stones. Sometimes, hammers were used to fragment the stones, but these methods were dangerous and rarely successful. Another approach was suprapubic lithotomy, which involved making an incision above the pubic bone to access the bladder directly. This method was first recorded in the 16th century but was not widely used because of its high mortality rate. During those times, surgeons who specialized in these operations were called lithotomists. They often traveled from town to town offering their services. The Hippocratic Oath even warned physicians against performing such risky procedures, recognizing how dangerous they were. The survival rate was low, and many patients died from shock, blood loss, or infections. Those who survived often faced permanent injuries like incontinence or fistulas, and the trauma of undergoing such painful procedures without pain relief was immense. The arrival of modern anesthesia in the mid-1800s changed everything. It allowed surgeons to perform these operations with less pain and greater safety. Later, the discovery of antibiotics helped prevent deadly infections. Today, bladder stones are usually treated with minimally invasive techniques like laser lithotripsy or endoscopic removal, which are much safer and more effective. Understanding this history highlights how far bladder health care has come. While bladder stones are now rare in developed countries, they can still occur, especially in people with chronic bladder conditions or after certain treatments for bladder cancer. Recognizing symptoms like pain, difficulty urinating, or blood in the urine should prompt a visit to a healthcare professional. Early detection and modern treatment options can prevent complications and improve quality of life. Always remember, if you experience any symptoms related to bladder health, consult a medical professional. This historical perspective shows how crucial advances in medicine are for patient safety and well-being.